Mornings with Brian here on WCRF. We're at 7:08, and in studio with us is our friend. Love when he comes in. There's so many interesting things to talk about from a faith perspective when it comes to mental health. Dr. Steve Grcevich is a local child psychiatrist and president and founder of Key Ministry. Welcome back, Doc.
Thanks for allowing me back in. It's been 8 years now that we've been doing this. And
Wow.
in our situation, this is really unique around the country. So I'm very grateful at Christmas time to you guys for affording us this platform to talk about some of the struggles that folks have with mental health issues, especially kids.
That's very kind of you. I guess I never know what's common and what's not. You're saying it's not often that you hear Christians talking about these kind of things?
No, I'm not aware of anywhere in the country that a child psychiatrist has access to a morning show like yours to regularly speak into these issues, Christian or not.
Well, I'm grateful to God that he connected us because it's been a huge thing. And today's topic is personal for me, and it's super important, and I think it's underestimated. But to get right to it, you spent a ton of time yesterday doing something that you normally would not have to do in your practice, yeah?
It was especially bad on Monday, and I have had weeks this year where I have spent more time rewriting and reissuing prescriptions for medicine for ADHD than I have spent seeing patients.
And it's just that particular disorder you're talking about.
It is just ADHD, and it's all related to the difficulties that folks are having in terms of finding their medicine or medicine for their child, because we've been dealing with chronic shortages now. We are entering the second year where this is a problem. And there was actually an article in a Plain Dealer over the weekend that said that there are pharmacies that are anticipating that this shortage is going to persist into 2025.
Great. Wow. Yeah, and I'm out of the gate, I've been open about this before. I'm so grateful that my wife, Sarah, is so open about this. She was diagnosed with ADHD at age 40, and it changed her life. And I'm not being melodramatic when I say that. And I have a child who's been diagnosed with ADHD, and the medication has no question improved his well-being and his life. But I also grew up in a generation where you were in your early career, and people kind of scoffed at ADHD. Can you talk about your early experience in your practice and in your research with ADHD?
So I first got exposed to this. I was doing a moonlighting job, making extra money so that we could buy a house when I was doing my child psychiatry fellowship. And I happened to work in a clinic where, the doc who started the clinic recognized that this was a big problem, and a lot of folks started coming through there and seeing this. And so there were a lot of misunderstandings at the time about this, that there were docs who believed that you could diagnose kids by giving them one dose of an ADHD medicine. If they got better, they had it. If they didn't, they didn't. And that was like an utter and complete wives' tale. That there were folks who thought that these were just kids who were utterly undisciplined. One of my favorite quotes, and this is from a extremely well-known, highly regarded Christian pastor who used the word unregenerate to refer to a 5-year-old with ADHD.
Oh, really? Oh, that's horrible.
Yeah, at a church that otherwise does an exemplary job of welcoming families impacted by disability. But the implication was that if you had a kid who struggled with self-control, it's because you don't care enough as a parent, or you don't have the commitment to doing the level of parenting that your child needs to be able to maintain self-control.
Well, I have clear memories when in the late 1980s, when there was, I think, a surge in diagnoses of ADHD, hearing my parents and their peers were kind of scoffing at it, like, this is some new diagnosis. No, it's just kids won't behave. It's bad parenting. That's what's happening.
Well, it became a big thing. It was really like the late 90s, and 2000, 2001, 2002 were where we started seeing a lot of this because of the advent of longer-acting ADHD medicines.
Oh, interesting.
Up until 2000, a lot of the things that we use, like the stimulant medicines that we use, were very short-acting. And so that, when a kid needed this stuff, they had to go down to the office every day at school, to get a pill. And so when the extended release forms of these things came out, and it was Concerta in 2000 and Adderall XR in 2001, that there was an explosion of interest in this because parents could, go to their doctor and their kid could get treated without the school having to know about it, which was one of the things that made a big difference. Now, the interesting thing now is part of why, or one of the reasons why there's a shortage, and that there's been so much of an expansion in the use of this medicine, is that it's predominantly adults. And in fact, the likelihood there are more women between the ages of 50 and 55 taking medicine for ADHD than there are girls under the age of 10 on a percentage basis.
How do you explain that? That's an incredible statistic.
So how do I explain that? And I think about ADHD, that this is almost sort of like a classic model of like the cultural model of disability. And what we mean by that is that, that there are folks who say that it's the expectations of culture as opposed to, specific physiologic issues sometimes in the people themselves who will, that cause them to struggle. And so when we think about folks with ADHD, people think about kids classically, who are hyperactive, restless, struggle with self-control. The vast preponderance of folks, particularly adults, don't have those issues. The issues they have is with,
they may have had it before, but not anymore.
So that if you think about like the people with ADHD tend to have developmentally inappropriate struggles with inattentiveness and disorganization, poor impulse control, and hyperactivity. The hyperactivity people tend to outgrow first.
Interesting.
The impulse control stuff gets better next. The stuff that tends to persist into adulthood are the struggles with planning, organization, procrastination, setting priorities, managing time, delaying gratification. And that, interestingly enough, one of the things, you mentioned your wife being diagnosed at 40.
Yep.
When I was doing some consulting for one of the drug companies that was interested in this, the average age of diagnosis for an adult is 41.
Wow.
And I had assumed that it would be like folks who are like in college or graduate school. But the issue is that typically at that point in time, adults are dealing with more demands than at any other time in their life. That they're at the peak of their career. They're raising kids. They're oftentimes caring for parents. They have all these other responsibilities outside the home. And one of the things that starts happening, given the amount of stuff that people are tasked to do, is that when your coping mechanisms and your compensatory strategies start breaking down, people struggle greatly. And that manifests itself in, performance on the job. There's a family I was seeing on Monday night where the family's in crisis because dad can't get his medicine, and dad can be cruel and emotionally abusive and has trouble self-regulating his emotions when he doesn't have his ADHD medicine. That we know, for example, that folks like teenagers with ADHD get into 3 times as many collisions. They get 3 times as many speeding tickets. They're 5 times more likely to lose their driver's licenses because of multiple moving violations. And interestingly enough, in addition to trauma, ADHD from a psychiatric standpoint is probably the thing that is most likely to lead to substance abuse issues.
Powerful statistics. It's 7:17. You're listening to a conversation here on Mornings with Brian at WCRF with Dr. Steve Grcevich, again, local child and adolescent psychiatrist and founder and president of Key Ministry. There's a significant shortage of ADHD medication. And when we come back from this break, we'll not only get his tips on what to do if you're struggling to get that medication for you and or a loved one. I also want to be sure we directly address the skeptics of ADHD. And we've got a doctor here with us that knows the science and will once and for all put to bed your doubts whether it's an actual thing. 724 WCRF Mornings with Brian. Dr. Steve Grcevich with us. He's a local child and adolescent psychiatrist and president and founder of Key Ministry. He's been confronting, as well as many other physicians across the country, a shortage of ADHD medication that's really impacting people's lives. One of my big frustrations in life, particularly from the church, is how dismissive the church has been over the years, that it's a thing. What they say is that kid doesn't have ADHD or that adult. What they have is a discipline problem and an obedience problem. Can you put that to bed?
Well, yeah, it's interesting because I remember when our church, just 25 years ago, did our first disability ministry Sunday. One of the couples that got up to give their testimony was talking about what their experience was like trying to find a church in suburban Cleveland with their 2 young sons with ADHD. And the mom's statement is that people in the church think they can tell when a disability ends and bad parenting begins. And that it was very hard for them to find a church where they felt accepted and not judged.
So ADHD is a neurochemical
absolutely. Yeah,
disorder.
It's a neurodevelopmental disorder. About 75% of the cases are genetic. There are other things that come into play. So that, for example, kids who are premature, like if you're born 34 weeks or earlier, you're 5 times more likely to have ADHD. If your mom smokes while she's pregnant, you're more likely to have ADHD. We tend to see a disproportionate amount of this stuff in kids who've maybe been exposed to trauma and neglect because it impacts sort of the connectivity and the top-down control in the brain. So that this is absolutely biological, absolutely genetic. There is irrefutable evidence if you take a look at different neuroimaging studies showing that that there are several key areas of the brain involved. One is the prefrontal cortex, which is the part of your brain that's involved with sort of all of the higher order processes that regulates what goes on at lower levels of the brain. So that this is what is involved, impulse control, self-regulating emotion, what we talk about, verbal or nonverbal working memory, which is, to be able to take in words or pictures, to remember something that happened and learn from your mistakes. So that's tied into your prefrontal cortex. There are pathways involved in the midbrain with projections to higher areas of the brain that are involved with focus, concentration, the ability to stay on task, motivation. All of that stuff is impacted in folks who struggle with ADHD.
So it's not a problem of self-control or choice. It is a biological issue, just like somebody who may not have a leg or an arm.
Absolutely. And I mean, I will say that the way that we talk about this, or parents ask me, well, can they or can't they control it? A better way of thinking about it is that they can control it to some degree, but it consumes much more of their cognitive resources to try to do that.
Yeah, it's exhausting to try to do it. And so probably they come home from school and they just totally fall apart.
Exactly, because they've expended 15 hours of mental energy to get through a 7-hour school day.
Oh, I like the way you put that. And one thing that you told me years ago that was a game changer for my family was when my wife was diagnosed. You talked about statistics of children of adults who have ADHD. What's the likelihood?
If a parent is being treated for ADHD, the odds that any one of their kids will have it is 50-50.
50-50.
50-50.
That's a huge statistic. Now, I guess as we drift into the medication problem, is the pharmaceutical industry and the medical industry prepared for this increase in diagnoses?
Oh, so here's why this is different than everything else in medicine. Because, for example, if you have, people, if they need more antibiotics, or if they need more, or whatever it is that you would be like using. If you need more thyroid medicine, the companies can just go ahead on their own and make more. You can't do that with this stuff because the stimulants, which are 98% of what people use to treat this, are controlled substances. Mm-hmm. And the amount of raw ingredient that you can manufacture is very closely regulated by the DEA, not the FDA. And so part of the reason why we have a shortage right now is that there was a big spike in diagnosis during COVID. And typically the rates at which adults were being diagnosed were increasing 10 to 20% a year during COVID. Some of this was happening at online clinics that were maybe using not the most thorough kinds of diagnostic procedures. And so there are a lot of folks within the DEA who believe that a lot of these diagnoses are, in a sense, fraudulent, and that people don't really need this stuff, and that you're putting controlled substances out into the community, that in the wrong hands may have some abuse potential. In my experience, it's very unusual for folks with ADHD to abuse their medicine. I have a hard enough time getting kids to take it because of some of the side effect issues. But as a result, on a yearly basis, the government gives a quota to each company that makes ADHD medicine in terms of how much they're allowed to manufacture. The problem you get into is that at the end of the year, if more of a specific product gets prescribed than what was anticipated, you run out in November and December. What has happened this year is because, and this started like a little over a year ago, with there being a shortage specifically of Adderall XR, which is the most commonly used medication to treat ADHD. When folks haven't been able to find that, docs have prescribed other things. So now that we're basically out of everything across the board. And so we have a situation where, because the government won't increase the quotas that the drug companies are allowed to manufacture, there are more legitimate prescriptions for ADHD medicine floating around than there is medicine to fill them.
Mm. Wow. Do you have time to stick around a little bit longer today?
Oh, absolutely, yeah.
Because what I'd like to get to is I want to be sure we cover what to do if you're facing this. Because to be honest, one of my kids has both epilepsy and ADHD. And in our family, it's just as big of a deal to be low on the epilepsy medication as it is on the ADHD medication. And I bring all that up because I want to be sure people understand this is not just some rare disorder it's very common.
No, you're talking about...
And it's life-changing.
Yeah. So 1 in 4 teenage boys, 1 in 8 teenage girls are taking medicine for ADHD. But again, we're talking about like 5% of the adult population at this point.
And it's probably going to keep going up.
Mm-hmm.
So what do we do? How do we get the medication we need for our loved ones? Are there alternatives? Like if you can't find medication, like homeopathic ideas. We'll talk with Dr. Grcevich about that and more. You could also get your questions in if you had them. I know many comments are coming in. 440-546-2255. 738 WCRF, Mornings with Brian. An extended conversation this morning with our friend, if you're just tuning in, Dr. Steve Grcevich, a local child and adolescent psychiatrist and president and founder of Key Ministry. We didn't get to some really important things that I want to be sure we get to here as we talk about a nationwide shortage that's getting worse of ADHD medication. We've established it's not a discipline problem. It's not a parenting problem. It's a legitimate disorder, a neurochemical in nature, physiological, genetic, and the medication is necessary. It helps.
Absolutely.
But so what can someone do if they are unable to get their ADHD medication for them or their child?
So one of the things, and some of this is because of some of the side effects associated with it. By and large, my experience is that most people aren't thrilled with having to take this stuff. So I have kids who maybe skip it on Saturday and Sunday, or they take it on Sunday for church, but skip it on Saturday so that they can eat. So the first thing that I encourage parents, especially if they're not using it absolutely every day, is that the very first day that you are able to get another prescription refilled, to go to the drugstore and try and get it done. Because you don't want to be in a situation like what I'm seeing. And I talked to a mom yesterday whose, son is a college student who called 20 different pharmacies and wasn't able to find his medicine.
Yeah, I'm not surprised to hear that.
And that where it's really essential coming up on final exams in terms of being able to focus and concentrate to be able to get that. So the first thing would be that if you are able, because of insurance and the time frame, between when you can renew prescriptions, if you have an available prescription, get it before you run out of it. which is hard sometimes for people with ADHD to do because they struggle with sort of like planning and foresight and
Right.
issues like that. Yeah. So that would be the first piece.
Do you recommend rationing? You kind of mentioned that in passing. Like if you can hold off a day or two to make it last longer, is that recommended or not?
That would be something folks have to talk to their individual doc about, because there are some kids I would be very worried about being out on the road this morning.
Okay.
If some of my kids were driving to school and they weren't on their ADHD medicine,
Gotcha.
I mean that there could be some pretty serious safety issues. So that would be the first thing. The second thing that I would do is that, if when you get into a pinch like this, if you reach out to your, the doc or the person who's prescribing the medicine, are there other things that are very similar to it that would give you the same kind of response that, that would give you the same benefits when the product of choice isn't available? I hate changing people's ADHD medicine, because when I find something that works right, I don't want to be in a situation where we're undoing that. But for example, like with like the long-acting medicines, Adderall XR and Concerta being the most common, that there are shorter acting versions of that do the same thing and have the same active ingredient, but you might have to take it more often during the day, or your kid might have to go to the nurse's office or the principal's office to get a dose at lunch. There are, in some instances, the brand medication that's considerably more expensive is available oftentimes in situations where the generics that the vast preponderance of people use aren't. So that, if you're a family that has some resources and you can't afford Adderall XR, being switched to Vyvanse, or there's another product called Adzenys, which is a tablet that disintegrates in your mouth. Those might be options, but those things may cost like $300, $400, $500 a month versus like the $20 or $30 or $50 a month that people are accustomed to paying.
Is there a way to battle insurance to get them to cover it in the midst of a shortage?
There are some folks who, there are some folks who look at that, but I can tell you that process is so time consuming and overwhelming. It's not something that I'm able to do for my patients anymore, because
Gotcha.
I can't spend hours dealing with insurance companies. But again, in like larger psychiatric clinics or pediatric practices, they have staff who do nothing but deal with this stuff. There are also some other, and not to share all of my little secrets, because but
some physicians might be listening.
Yeah, but there are some lesser known products that are available that aren't often prescribed that are very, very similar, to some things that are on the market. For example, there's dexedrine Spanchules and Adderall XR. 75% of the stuff in Adderall XR, it's the active ingredient in the dexedrine Spanchules. There's a drug called Avicchio that never became very popular. That's actually the modern day version of Benzedrine, which was the first drug studied for ADHD in 1937. So the Adderall actually has two different chemicals in it. So it has what we call dextro and levoamphetamine. Adderall is 75% dextro, 25% levoamphetamine. Dexedrine's 100% dextro and 0% levo. Avicchio is 50% dextro, 50% levo.
So something's better than nothing.
Well, yeah, and so, but these things, but one of the challenges is that sometimes if you're using something that's a little different chemically, people may not respond quite the same way, in terms of either getting the desired benefit or avoiding undesirable side effects. So that there are 37 different FDA-approved products on the market. 33 of them are stimulants. They all share one of two common ingredients. So that all of these things are either based upon some sort of amphetamine salt or prodrug. That would be things like Adderall, Adderall XR, Vyvanse, dexedrine Spanchules, Mydayis. The other family has as its base ingredient a chemical called methylphenidate. That would be things like Ritalin, Focalin, Concerta, Metadate. There's a Daytrana patch. There's equivalent liquid. Both of those families of medicines tend to be highly effective. And if you give a kid a trial with one of the drugs from each category, the odds they'll respond to at least one of the two are 92%. But there are more kids who clearly do better on one versus the other. So that, for example, if you do well on Concerta, it doesn't mean you're going to do well on Adderall. If you do well on Adderall, it doesn't mean that you're going to tolerate or respond to Focalin. There's a lot of trial and error in this stuff. And it can be challenging because, the medicines, especially for somebody where this is a focus of my research and it's what I do, the subtleties make a big difference in terms of how people respond. But there may be things that your doc can do if you can't find the medicine that you're taking. One of the other things I would have folks think about a little bit, and our experience has been that the locally owned independent pharmacies seem to be doing a better job of keeping things in stock than the national chains.
Oh, interesting.
Yeah. So that, for example, like a lot of these come, for example, CVS has its own pharmacy benefit manager. It's impossible at this point to be able to get the stuff for the people who do these 90-day mail-in kinds of things through Express Scripts and stuff like that. But I'm finding folks have had, at least up to now, more success. You think about some of our local Northeast Ohio chains.
They're all over the place.
Drug Mart, Mark's, Giant Eagle, Acme. Even
seems small community pharmacies are still around.
The ones that have not yet been put out of business by these monolithic chains. They seem to be doing a little better job of keeping stuff in stock. Sometimes it's easier if you go to an outlying area, so that I've told kids, don't expect to be able to find your ADHD medicine on High Street in Columbus if you're going to Ohio State and need it before finals. But for example, out where you live, sort of in the whole Garrettsville area, sometimes in the rural areas that they may have stuff that the pharmacies that are across the street from a college or university wouldn't have.
Before we go today, we had someone ask about homeopathic alternatives. Do you recommend that? Are there any?
I mean, there are certain non-pharmacologic treatments that have been helpful. There've been some evidence suggesting that cognitive behavioral therapy can be helpful. I have more and more kids and young adults who are using executive function coaching. While individual kids may respond to certain types of restricted diets, there have been at least a dozen large controlled studies looking at the effects of diet and food additives, and none of them have ever shown a statistically significant difference. But if your kid is swinging from the chandelier when he drinks Mountain Dew, don't give him Mountain Dew. They just haven't been able to demonstrate it in a large study. And I know one of the other folks who sent a text in was asking about the misuse abuse on college campuses.
Yeah.
There was an interesting study that when we talk about, there's a difference between misuse and abuse. Misuse is a situation where you have a kid who's heard that Adderall helps you study for finals, where they don't have a formal diagnosis, but they get their hands on it, and they're doing it to try for academic enhancement, versus abuse, which is where people would be doing it to try to get a high. There's an interesting study that showed that the rate of misuse on college campuses was directly proportional to the average SAT score of the incoming freshman class. Ergo, the smarter the kids are and the more competitive the college, there was maybe more of a tendency for people to be looking for something to try and give them an advantage.
Wow.
The biggest problem, and this was something I heard about, not only from my own patients, but my daughter and son-in-law, in addition to, when they met at college, at their campus church, they were both EMTs, or, that they were part of the volunteer emergency medical technician service at Loyola. And the other place where this has been misused is kids taking the stuff because it offsets the sedative properties of alcohol, and that they feel like they can go out and party longer and drink more. The danger to that, it's not a direct drug-drug interaction, but the issue is my daughter and son-in-law were finding these kids passed out on campus with really severe alcohol poisoning. I mean, emergency kinds of situations, because when folks would take this stuff, and this is one of the reasons why I would caution college kids against doing that if they're planning to go out and drink, is that the normal typical mechanisms that cause you to stop drinking may not work in the same way for folks who are taking this.
It's been a fascinating discussion today and a real important one, as there is a shortage of these medications. And I think we do still need to do some work in the church to change thinking about ADHD. So thank you for that. Dr. Steve Grcevich has been our guest. He's a local child and adolescent psychiatrist and a national leading expert in this particular area. And he also is president and founder of Key Ministry. For more information, go to keyministry.org, keyministry.org. Thank you for your extra time today and for your expertise, my friend.
Thanks, guys. Merry Christmas to all of you.
You as well. Matthew West on WCRF. It's me and my frog.
Ribbit.
Oh, no, it's
Ribbit.
catching.
Sorry about that. Get out of there, froggy. No, I'm so grateful for Dr. Steve Grcevich having been with us. Mental health is such an important topic. It's something we're passionate about here. I wish it was more common in Christian radio and in ministry. Key Ministry really is all about helping churches be more welcoming to people with various types of disabilities,
Right.
including mental health disorders. Yes, that's a disability. It's sad. I mean, Daria, you were commenting to me about how poorly churches have handled this. We need to make it normal that if you have a broken arm, you go to the doctor. Duh.
Right.
If you're struggling with your mental health, you go to a doctor.
Yeah, as someone who has struggled with mental health for majority of my life, my mom knew when I was 2 that something was wrong. I've had so many church people, well-meaning, just say, "Oh, here's a Bible verse." That doesn't help.
No.
No, not at all. In fact, it makes it worse. And then blaming parents for a child who has a disability. Are you kidding me? What are we doing?
Just adding guilt on top of what they already are struggling with.
Yeah, and as I was hearing Dr. Grcevich talk about how some of the alternatives that are available for folks with ADHD having trouble getting medication are so expensive. Think there's an opportunity for the church there?
I could see one.
That's something we're really good at, actually, is we generally have groups of people with lots of money, and I would hope that we could support people who need it. Because it really, it's silly that I have to say this, but it's a real disorder.
Right.
It is. They're not making it up. It's not. I mean, technically, it is in their head, but they're not imagining it.
And I say that because years ago, I was a person who was skeptical whether it was a real thing or whether it was just a problem with self-discipline. And I'm ashamed to say that I was one of those people. If you have that still in your head, I love you, but you're wrong. Like Dr. Grcevich said, he was worried about safety on the road for teenagers who are not on their medication. This is a big deal. So anyway, soapbox, I'm getting off of it. Coming up in just a moment, we're going to have our friend live answering your Bible questions and questions about the spiritual life. Dr. Rydelnik is out, but we've got another doctor in, Dr. Nick Gatsky, senior pastor of Old North Church in Canfield and Bible teacher on A Better Word heard on Moody Radio. He's ready to answer your questions. Call or text with those Bible questions right now. 440-546-2255. Again, 440-546-2255.